with one death and more people testing positive for the coronavirus, will our region see an explosion in cases like New York? Action News Now reporter anchor Julia Yarbo put that question to Stanford researcher Dr. Michael Lin, a COVID-19 expert.
Is there somewhat of a tipping point or a threshold where all of a sudden a community needs to be aware that they're going to explode in cases?
You know, the big problem with this virus has been the long incubation period. As Dr. Gill mentioned, you can have the virus for 5 to 7 days and be transmitting for some of the time and not realize it. So what's happened in places like New York and Italy is that transmission happened in the background before people realized it. And the mild cases are just like a cold or just like the flu. And so people might just believe they have something else and not the coronavirus. I would say the real warning sign is when you have at least one patient in your community who has been diagnosed with the virus. And that means that the virus is already going around. If you have deaths in your community, that's a very bad sign, because that means enough of the virus has gone around that some people have started to die from it. The death rate overall is about 1%. So if someone has died, that means the virus has been in your community and it's probably already infected hundreds of people for a few weeks. And so that's a major concern. Once you see deaths, you're going to see a few more weeks of rising hospitalizations and fatalities, because that means the virus is already spread in the community.
Dr. Lin says this pandemic should teach all of us and government leaders the importance of being educated and aware before a crisis hits. And we can't stress this enough. Washing your hands, not touching your face, and keeping your distance are keys to beating this virus.